Good afternoon, everyone. My name is Christine Zeller, and I'm a program manager in the MCW Office of Community Engagement. Thank you all for joining us today as we celebrate the exceptional individuals who are the recipients of this year's President's Community Engagement Awards. Please note that this session is being recorded. Also, we have a special commemorative booklet of the ceremony in a PDF format, which we are posting in the chat a bit later, and which is also available on our public website. We also will be posting the recording of this ceremony, and we'll send out the link via email and other channels. To our audience, please stay mute and with your cameras off. Awardees, please turn your cameras on when you are being acknowledged. We encourage everyone to share comments by using the chat bar. At this time, I would like to extend sincere thanks to the members of our President's Award Committee who devoted much time and thoughtful consideration to carefully reviewing the many outstanding nominations to inform the selection of the winners that we honor here today. Our committee members this year are Allison Devan, Sabina Deer, Lisa Dodson, Mark Flower, Tiffany Frazier, Brett Fuller, Kathy Kuhn, Michael Levis, John Moyer, Sharon New Young. Thank you very much for your continued and dedicated work. We also have a record of each awardee engraved on a large wall plaque of all historical winners that we proudly display in our office area. As part of this award ceremony, we in the Office of Community Engagement acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. At this time, I would like to introduce MCW President and CEO, Dr. John R. Raymond Sr., with many thanks from our office for his continued support of this very special and important award.
Thank you so much, Christine, and welcome to everyone. Good afternoon. Congratulations, and most of all, thank you for the amazing work that you're doing to bring MCW closer to our values and to our partners in the community. This is always an uplifting day for me and a humbling day because of the work that you do that's so essential to the vitality of our region. So I want to thank you for that. Before we get started, if we could just pause for a moment of reflection or prayer for the victims of the shootings in Buffalo, New York, and Uvalde, Texas, the tragic and senseless violence, the lost lives and potential, and just a terrible loss for all of us. Again, thank you for your work, and also thank you for the moment of silence and reflection. It really is my great pleasure to welcome all of our awardees, guests, partners, faculty, staff, students, and our various stakeholders to Medical College of Wisconsin's annual President's Community Engagement Award ceremony. We're conducting it virtually this year, but hopefully we'll use the chat box to maintain that sense of connection and community that really is special for MCW and all of you. You know, our institution has a strong and proud history of supporting community engagement. In fact, we were one of the very first organizations and medical schools to have community engagement called out as our fourth mission. And at its heart, community engagement at MCW encompasses elements of education, clinical care research, prevention and control, global health, community outreach, and service. And we are dedicated to leadership and excellence through our community engagement mission. And the work that you do by partnering with public and private organizations enhances learning, research, patient care, and the health of our communities in Wisconsin and beyond. We're so very grateful to all of you for that work. The President's Community Engagement Award recognizes exemplary community academic partnerships, community engaged research, and the community outreach activities of faculty, staff, students, and our community partners. Now, nominations were reviewed by members of MCW's Community Engagement Award Committee, which Christine has already acknowledged and thanked some of the members of. And I also wish to extend my sincere thanks to the individuals for their continued dedication and support of this really important award. So the committee rated nominees according to institutional and community impact, the strength of the community partnership, efforts given toward the partnership or project, and evidence of exceptionalism in the partnership or project, and then finally overall merit. And these are important criteria. And I would have to say, based on my interactions with the nominees in the past, very difficult for us just to choose a handful of awardees because of the amazing work that so many people are doing. So the recommendations of the committee were shared with me. And again, I was humbled and amazed by the quality and impact of the work being done by so many. I'm impressed with the achievements and accomplishments of all of our nominees, and personally touched by the dedication that all of you have to advance community health in Milwaukee, at our regional campuses and beyond. And with each passing year, we do build a larger and stronger group of people who are dedicated to achieving excellence in community engagement. I think part of that is understanding that MCW alone can't improve the health of our communities, that we need true partnerships, and that we need to shift our focus from just a healthcare focus to one that embraces all of the determinants of health. And so the awardees, your presence here is a powerful testament to your impact on community engagement, to making sure that we understand what drives health and not just healthcare, and to the wealth of resources that we built for improving the health of the communities that we serve. So I thank you for being here and for being exemplary representatives and dedicated stewards of our community engagement mission. And with those words, I'd like to now turn the program over to Dr. Staci Young, who will introduce and celebrate our awardees. And I'm sure most of you already know, but Dr. Young serves as MCW's Senior Associate Dean for Community Engagement. And she's also an Associate Professor of Family and Community Medicine and Director of the Center for Health and Communities and Research. Dr. Young, we're grateful for all that you do for MCW and our community, for your leadership, and for serving as a mentor and role model. Thank you.
Thank you so much, Dr. Raymond. I'm so proud and happy to be here to present the 8th Annual President's Community Engagement Awards to the outstanding individuals we honor here today. With each passing year, we build a larger and stronger group of people who are dedicated to achieving excellence in community engagement. To our awardees, your presence here today is a powerful testament of the impact of community engagement and the wealth of resources we have built for improving the health of communities that we serve. Thank you for being here as exemplary representatives and dedicated stewards of our community engagement mission. I'd like to begin now with presenting our first award in the category of Community Partner or Program. And I'm very pleased to announce Joy Tapper as one of the recipients. Joy has over 30 years of experience in healthcare policy, planning, and administration. She serves on many civic and health committees in Milwaukee and across the state, as well as on the boards of the Wisconsin Primary Healthcare Association and the MCW Advancing a Healthier Wisconsin Endowment. She currently serves as the Executive Director for the Milwaukee Healthcare Partnership, a 15-year-old public and private consortium dedicated to improving healthcare for low-income and underserved populations in Milwaukee County. This past year, under Joy's leadership, the partnership achieved a significant goal in breaking ground on the new Milwaukee County Mental Health Emergency Center, which will serve as a national model for emergency crisis care that is patient-centered, recovery-oriented, and culturally informed. Joy has also served as a public member of the MCW Consortium on Public and Community Health since 2011 and has served as its chair since 2019. During this time, she has participated in the awarding, management, and oversight of more than $60 million in direct grants to support 139 community and public health projects. Each of these projects supported a partnership between an MCW faculty member or group and a community partner, which is the very embodiment of the community academic model. In March of 2020, when COVID-19 was just emerging as a threat, Joy stepped forward to support an urgent COVID response plan, which ultimately led to the awarding of nearly $5 million to projects that saved lives. Congratulations, Joy, for receiving this award.
Thank you, Staci, for your kind words and for this special recognition. I'm honored to accept this award actually on behalf of the members of the Milwaukee Healthcare Partnership who have been working together for the past 15 years to improve access to care for low-income and vulnerable populations in Milwaukee County, and more recently partnering with many of you on addressing other community health needs with a focus on health equity. Since 2007, the 4 health systems, the 5 federally qualified health centers, the city, county, and state health agency have worked together and individually to increase access to healthcare insurance, to primary care, to screen for housing and other social needs, and more recently to tackle tough community issues such as mental health, COVID, and violence prevention. And while there's so much more to do, I'm grateful for this opportunity to salute them in their level of collaboration, and I'm proud to serve with them in service to patients in the community. Thanks again for this recognition.
Thank you, Joy. And please take a moment to review the chat. There's so many wonderful comments and kudos and congratulations coming in. Our second award for Community Partner goes to the Community Mobilization Team of Lorraine Lathan, Aziz Abdullah, Nick Tomorrow, and Marcus Austin. This amazing team led an integrated community engaged effort to increase COVID-19 vaccine uptake in socially vulnerable communities. These individuals designed a nimble community engaged program to recruit, train, and deploy 150 community-based mobilizers and a team of vaccinators to visit socially vulnerable neighborhoods and go door to door to talk about vaccines and provide vaccinations in people's homes. I am pleased to honor each of these extraordinary team members who individually are worthy of this award. Ms. Lorraine Lathan is president and founder of Jump at the Sun Consultants, LLC, a Black and woman-owned firm with a mission to provide innovative and culturally relevant technical support to nonprofit, public health, and private sectors working to improve the well-being of those living in poverty. Lorraine's vision is a world of hope, tolerance, and social justice, where everyone lives in dignity and has equal opportunity to achieve optimal health. Lorraine has more than 20 years of experience in designing, implementing, and evaluating health promotion and disease prevention programs in Africa and Wisconsin. She is widely recognized as a leader in minority health advocacy, community engagement, and social marketing. Lorraine brings extensive expertise and experience in working with underserved and marginalized populations in areas with the highest social vulnerability index scores in Wisconsin. Lorraine and her team led focus groups to ensure that materials and messages were community informed and developed training modules and led recruitment for the community mobilizers. Thank you, Lorraine, for your continued partnership with MCW.
Thank you. So on behalf of my agency, Jump at the Sun Consultants, our community mobilizers, and the communities that we serve, I want to share with you that it is with great pride that we accept this award. Our agency has been around for 15 years, and our focus is on improving the health and well-being of people living in low-income communities. The pandemic provided us with a challenge. It certainly revealed the inequities that exist in our communities. So the work we do is through the lens of health equity and social justice, but more importantly, we work within and for communities to address these disparities and to improve social determinants of health. Again, I can't express how thrilled we are that we were able to forge new partnerships with the health department, with Alvernal nursing students, with people in those communities. And we were able to use the EVE model that was developed by Dr. Ben Weston from the medical college. So we were able through this partnership to take the vaccine and the information into those communities, and quite often communities where people thought that they had been forgotten. We were able to vaccinate lots of people and build trust and credibility in those communities. But again, it would not have worked had we not worked so closely and so well with the health department and with the community. So thank you again for the award, and I'm going to close it with that.
Thank you so much, Lorraine. The second member of this awarded team is Mr. Aziz Abdullah. Aziz is the co-founder and director of strategy and client innovation at InPower, a Black and women-owned marketing firm based in Milwaukee's Harambe neighborhood. InPower provides strategies and technology tools for healthcare, social care, and educational organizations dedicated to improving the conditions of vulnerable communities, addressing healthcare, voting rights, and economic issues. Aziz is a lifelong entrepreneur dedicated to positive social impact. He began his career as a consultant for the digital development of WNOV, the first Black-owned radio station in Wisconsin, and Milwaukee Courier, the first Black-owned newspaper in Wisconsin. He and his team built Healthy MKE, an online platform for offering multilingual, literacy-friendly health education, information, and resources to serve as a hub for evidence-based, culturally competent COVID-19 information, as well as testing and vaccine resources. The hub remains in place today and has welcomed 450,000 unique visitors and more than 1 million page views since its inception. Aziz and InPower team members have been essential to the community-led mobilization program by developing the Authentic Voices campaign. Authentic Voices featured people from socially vulnerable neighborhoods in Milwaukee who shared their personal stories about the vaccine. This program also provided weekly relevant messaging through social media outreach and built a network of organizations to support the effort. Thank you, Aziz, for all of your important work.
Thank you, Dr. Young, and to the rest of the team and Dr. Raymond at the Medical College. I'm honored to be able to accept this award. Just want to make sure I can get it on screen one moment. On behalf of my team at InPower, the last 2.5 years have really shown how when we come together as a community and we focus on our commonalities and we put energy around, some of the challenges we face, how regardless of where you come from, what your socioeconomic background is, or what your perspectives are, when we can come together on common ground, we can really move forward and make a lot of things happen. So to the Milwaukee Healthcare Partnership, to the staff and team and at the Medical College of Wisconsin, to Lorraine Lathan, to Brother Marcus, to Dr. Tomorrow, so many, Nick Tomorrow, I apologize, so many people to recognize in this work. And it truly took a village, to really raise this up. So on behalf of everyone who's been able to be a part of this, I'm truly grateful and humbled and thankful for the opportunity. Thank you again, Dr. Young.
Thank you so much. And I hope in the audience you're enjoying the slideshow of photos. That's just a wonderful array of photographs representing all the great work happening amongst our awardees. So thank you for that. The third member of the community-led mobilization team that we are recognizing today is Mr. Nick Tomorrow. Nick leads the public health emergency response for the Milwaukee Health Department. Among his many roles as a public health leader, community organizer, and implementer on the front lines throughout the pandemic, he is applauded for stepping in as a collaborative partner on the community-led mobilization program. With a background in veterinary medicine, public health, and environmental health sciences, Nick brings a One Health worldview to the team's work, which strives to achieve optimal health outcomes by recognizing the interconnection between people, animals, and plants and their shared environment. Nick trained vaccinators through the Milwaukee Health Department and became partners with community members to jointly increase vaccine uptake in socially vulnerable neighborhoods. He worked in partnership with the team to walk neighborhoods and vaccinate individuals and families in their homes. Thank you, Nick, for your dedication and courage.
Thank you very much, Dr. Young. And really, I am here representing what's a wonderful team of people at the Milwaukee Health Department. I feel incredibly fortunate to be a part of serving the city. I want to thank President Dr. Raymond and all of those here involved just for your acknowledgement of the importance of community engagement, social determinants of health for impactful work. It's really truly been an honor for myself and others of us at the health department to be part of this community-led mobilization team recognized here, as well as just the really incredible array of community partners that we've been connected with throughout the pandemic response. Lorraine, it's been great getting to know you. Marcus, working with you from Jump at the Sun, Aziz at InPower, just your really impactful work with messaging and the importance of it. Joy and colleagues at the Milwaukee Healthcare Partnership, I cannot say enough and thank you enough about your convening and promoting cross-sector collaboration. Dr. Weston, so many people at Medical College that we work with directly. With this award, it's really important to me to highlight two individuals on our team who've really stood out in terms of their work in community engagement. Sarah Matusek and Violet Kreischick, who've really been critical for the community-led mobilization project from our team. Sarah had started with us at the beginning of the pandemic response, another initiative that's really been important and impactful for us at Clare Hall, really working with those who are housing unstable or experiencing homelessness, and really working with entities like the Milwaukee County Housing Division and others to connect individuals to housing and other services. Violet really did quite a bit of work in mobilizing around mask distribution before she then kind of picked up the mantle from Sarah in working with Lorraine and Marcus and others in the community-led mobilization at the neighborhood level, which was just this really great extension of the work we had done in terms of mobile vaccine and bringing vaccine into the community. I think last important thing to say is just I think myself and others on the team, and I think Lorraine and Marcus would attest, it's just really the most impactful conversations we have oftentimes right now are, especially at this stage in the vaccination campaign, meeting someone who might be getting their first or second dose of vaccine and just hearing from them how important it is that they had this opportunity at the neighborhood level directly in the community. So I think, we've learned a ton as a team, what it truly means to work in the community, working with these really outstanding partners that we've had the chance to. I think it's a time when we need to really move forward, be big and bold with our ideas and initiatives, and really look forward to the continued work together. So thank you very much.
Thank you, Nick. The final member of the community-led mobilization team that we recognize today is Mr. Marcus Austin. Marcus was recruited in July of 2021 as a community mobilizer to share information on COVID-19 and vaccines to neighbors. Following his training, Marcus built his leadership skills and now is the community-based field coordinator for the community mobilization program. Marcus works to train community members, knock on doors, and connect with people while showing compassion and respect. Marcus helped transition the program to an indoor effort during the winter months, with a mobilizer team hosting community-based events, visiting neighborhoods with public housing, and offering both vaccines and testing at people's doors. Marcus is considered the heart of the community-led mobilizer program today. Thank you, Marcus, for your important work.
Thank you very much. I am thankful for all of you at the Medical College of Wisconsin who saw me worthy enough to honor with this award. I am humbled. I would like to thank a few very important people who has made a difference in my life and has prepared me to make a difference in the lives of others. I would first, in all humbleness, like to thank my boss and my mentor, Miss Lorraine Lathan. I don't have the opportunity enough to say thank you. So I would like to humble myself even more and just say thank you for everything that you have bestowed upon me, everything that you have educated me with, everything that you've prepared me with. I'm truly grateful for the opportunity at Jump at the Sun. I'm thankful that you trusted me with leading a part of your mission and being a part of something that is greater than me. I'd like to also thank the following individuals. I'd like to thank MHD Commissioner Johnson. I'd like to thank Deputy Commissioner Deputy Commissioner of Community Health, Erica Olivier. I'd like to thank my co-nominee and friend, Nick Tamaro. Nick actually hit the streets with us. And like at first I didn't know who he was, and once I found out who he was, and he was just a regular person, and it humbled me. So I'd like to thank you for coming out with me, Nick, for coming out with us and just being a part of it. I'd like to thank the Housing Authority of Milwaukee County. I'd like to thank Ken. I'd like to thank Annette. I'd like to thank all the property managers at the buildings. I'd like to thank Carmela Harris, who always encouraged me to hustle to overcome. And it was to overcome anything or any type of negativity that would confront us. I'd like to thank my team of mobilizers, Contessa Lee, Malcolm Johnson, Miss Shirley, Mr. and Mrs. Ford, Malcolm Rogers. I'd like to thank Bruce Veal. I'd like to thank Elaine Lathan. I'd like to thank Miss Kiki from Alverno College. I'd like to thank all the nursing students that marched with us. And I would like to end this by saying it was a moment for me. It wasn't just a job, it was a moment. It was a defining moment in my life. And I wish for and hope and pray for greater things to come. So I'd like to thank you again, those of you who honored me, and I am truly grateful for this award, leave my award in here. So thank y'all. Thank you very much.
Thank you so much, Marcus, and to all of you, thank you for taking the time to acknowledge all of those that you work with, that are partners with you, and we recognize that it takes a team to work with a team to improve community health. So thank you for taking time during your acknowledgements to recognize those that work with you in this important effort. And also congratulations for your tremendous dedication and tireless service that you all have provided for your communities. Our final award in the category of community program is for the MCW student-led Saturday Clinic for the Uninsured and the 2020 and 2021 boards of directors. These boards were teams of medical and pharmacy school students who improved access to patient-centered, comprehensive, quality healthcare for under-resourced communities. They succeeded in expanding the clinic's ability to partner with the community to address health inequities on a broader scale. Some of their accomplishments include the implementation of their telehealth program, the development and further expansion of specialty care access, including adding ear, nose, and throat, hematology, and hand surgery care, the development of the COVID-19 educator role to answer patients' questions surrounding the pandemic and to provide them with up-to-date resources. They've expanded their screening for social determinants of health and the related education research committee, establishing the interpretation committee to increase access for patients, founding the public health committee to further address community needs, and joining the Wisconsin Public Health Association in its declaration of racism as a public health crisis, along with the establishment of the Anti-Racism Committee. These boards enrolled 30 students in the prescription assistance program, developed a patient and family advisory council to advance community engagement through patient collaboration, created an M3 and M4 mentor role to support first and second year students on clinic day, and partnered with the Wisconsin Association of Free and Charitable Clinics and their VISTA program to implement standards and work towards the Silver Seal of Excellence. This is an exemplary group of students who have dedicated countless hours towards service in their community and have made a lasting impact. Please join me in thanking them for their tremendous dedication and service to the Saturday Clinic for the Uninsured and our community. Each board was comprised of 13 individual students who are listed in our commemorative program. Accepting the award for the 2020 Board of Directors is Spencer Marting, currently a third-year medical student at MCW. Spencer?
Hello, thank you, Dr. Young, for just all those kind words. First, I just want to thank the Office of Community Engagement for recognizing the work of the Saturday Clinic that we've been doing these past 2 years. It's just a privilege to be able to accept this award here. It represents really like the shared work of 2 student boards to expand care to patients, despite all these challenges that we faced in the COVID pandemic. As the leader of the 2020 student board, I really want to thank the other 12 managers who were by my side virtually that year. Without their hard work and dedication, we would not have been able to do this or have the momentum to keep going forward where we are today. I also really want to thank Dr. Lund and as our medical director, hero, just dedicated teacher and faculty member for just all the support that she gave us and guidance throughout that year. You know, within a few weeks, we were able to work together and launch that telehealth service to provide care to our patients. And we would not have been able to do that without all of Dr. Lund's help or just the collaboration of our teams. I think this work matters so much because so many of our patients at that time were people who weren't able to shelter at home, have immediate access to high quality masks, testing, affordable healthcare. And that year was just such a difficult and uncertain time. So I think I'm just so grateful for my team's resilience and adaptability to change to new COVID screening protocols, putting together this new service. It really set us apart from other student-run free clinics that year, being able to stay open and be proximate with our patients. So I just have so much gratitude for being able to be a part of this work and its impact that we were able to have during that year. It's a special privilege to be recognized today. So thank you all so much.
Thank you, Spencer, for those wonderful words and for your leadership in your student role. Accepting the award for the 2021 Board of Directors is Morgan Leisring, currently a second-year medical student. Morgan?
Hi, everyone, and thank you again, as Spencer said, for those kind words, Dr. Young. And I am here on the behalf of the 2021 Board of Directors, and just wanted to take a moment to echo the sentiment and gratitude that Spencer had shared. This award is a representation not only of many hours of hard work of medical students, but pharmacy students as well, and being able to collaborate both with the medical college or the medical students and pharmacy students is something that is a great privilege for us in our learning, and then for our patients as well in the Milwaukee community. And so our board specifically was inspired by the dedication of those before us. And we did use this time over the past year to further access our patients had to timely medication refills, specialty care, and really trying to close the gaps and fill the holes that our patients were experiencing in the community after the pandemic had really kind of normalized for our communities. Additionally, we were able to partner with a lot of help from the physicians at Freighter, Ascension, and the medical college to continue to provide consults to our uninsured patients. They have a lot of needs for specialty care, and specialty care is something that they don't have access to as uninsured patients. And so it's very important and was important for us during our year to really increase access to specialty care. And I just want to thank everyone that we were able to partner with to provide over 10 specialties to our patients and continuing to grow that as well so they can have prompt referrals for their health concerns, which is not something that our patient population has access to. And so just as a closing remark, as a born and raised Milwaukee resident, it's been incredible to see students from across all parts of the world coming together really and serving this Milwaukee community and making this community our home. Even if you've been here for 1 year, some of our students 2 years. And so it's really exciting to see everyone kind of partner together and come to serve this Milwaukee community that so desperately needs access to healthcare. So thank you again on behalf of both boards, and I'll turn it back to you, Dr. Young.
Thanks so much, Morgan. Outstanding. Kudos to you and all of the students for your work with the Saturday Clinic for the Uninsured. And again, another congratulations for all those that were recipients of the Community Engagement Award in the category of Community Program. The second category of awards is for MCW students. I am pleased to announce the winner is Raquel Valdez. Raquel is a second-year international medical student from Torreon, Coahuila, Mexico. As an immigrant and fluent Spanish speaker, Raquel is passionate about using her skills to help the Latinx community and to work overall to promote community service and advocacy, women's health, migrant healthcare, reproductive rights, and reducing health disparities. In less than 2 years at MCW, she has expanded the volunteer opportunities for medical students to foster a deeper and more sustainable connection with the Milwaukee community in different areas of need. She has been the community service co-chair of the Latino Medical Student Association known as LMSA, and Medical Students for Choice at MCW. Within LMSA, she has been part of the community outreach project Venciendo la Pandemia con la Vacuna, Overcoming the Pandemic with the Vaccine campaign, where she helped secure funding to provide masks for the Southside community and also helped spread information about the COVID-19 vaccine at local churches and other community events. She also organized and established outreach programs with St. Augustine High School and Bruce Guadalupe Middle School to increase exposure to the fields of medicine and science for students in Milwaukee. As a member of MCW's American Medical Women's Association, Raquel coordinated and hosted the 2021 Vulnerable Population Symposium. The symposium consisted of a series of 5 lunch talks focused on the health of Hmong, Latinx, Black, veterans, and transgender populations. Raquel's work demonstrates her commitment to health equity and reducing health disparities in the community. Congratulations, Raquel, for receiving this award.
Thank you so much, Dr. Young. I am very honored to be receiving this award. And first, I would like to personally thank my mother and my family for being such an example of selfless work for others. Many of the community service contributions I have been able to achieve this year have been due to the help and efforts of my amazing peers, including all of the LMSA executive board members. And also, I would like to recognize the LMSA community co-chair, Laura Carrillo, who we together worked on a lot of the community service projects that LMSA was a part of. I would also like to thank United Community Center, or UCC, which has been one of the community partnerships that LMSA has worked with, and who spearheaded the campaign that worked with spreading information about the COVID vaccine in the Milwaukee community. UCC has done amazing work regarding vaccine hesitancy here in Milwaukee, and it was a great honor to work with them. So I would like to thank MCW for giving me this award and for honoring the work that I have done this past year. Thank you.
Thank you so much, Raquel. And also as a reminder to read through the comments in the chat, I really appreciate the spirit of the audience here and taking the time to recognize, congratulate, give your emoji applause to all of our recipients in the chat. That's really kind. It's I know a joy for our recipients to be able to read those comments. The third category of awards is for MCW staff. This year, we have 2 individual winners within this category. Our first awardee is Kelsey Heindel. Kelsey is currently a program coordinator in the Office of Community Engagement at the Medical College of Wisconsin. Kelsey has a passion for health promotion and wellness and uses her skills in program coordination to bring like-minded individuals together to support a healthy community. Her work contributes to advancing the community engagement mission through a variety of community academic initiatives, programs, and events. Throughout her career at MCW, she has worked alongside community champions to promote wellness, healthy eating, active living, and chronic disease prevention. Kelsey serves on the leadership team for the Milwaukee County organizations Promoting Prevention. This local coalition has allowed her to build strong relationships within the community. She currently also works on a CDC-funded grant focused on community aspects of chronic disease prevention, type 2 diabetes, and hypertension. During the pandemic, Kelsey and the team pivoted to a podcast called Days of Learning, which Kelsey succeeded in producing as a way to continue to effectively share important information in a novel way. Congratulations, Kelsey, for receiving this award.
Thank you, Dr. Young and Dr. Raymond. It is an honor to be receiving this award and to be among such a fantastic group of awardees and share this with my leaders, peers, friends, and family today. It also means a lot to be on the other side of the award this year after supporting the administration since starting in the Office of Community Engagement in 2015. It has been such an amazing opportunity to be a part of a program that recognizes the impact of community engagement and the value of partnership. A big thank you to Dr. David Nelson and the other Milwaukee County organizations Promoting Prevention coalition leaders for the nomination. to include Ms. Yvonne Greer, Brett Fuller, and Chris Simmons, and to my leaders in the Office of CE, Dr. Young, Christine Zeller, and Sarah O'Connor, for allowing me the flexibility to be involved in this important work. I am truly receiving this award on behalf of MCOP, which is made up of several local community and healthcare organizations, as this coalition has laid the foundation for my work in this space. Dr. Nelson and Yvonne are actually off winning other public health leader awards at WPHA today. Yvonne for the Spirit of Public Health Award and Dr. Nelson for Excellence in Public Health Research. So they are unable to be in the audience, but this only speaks to their leadership and community engagement, and I am honored to work alongside them. I'd like a big thanks to be on the record for Dr. Nelson for his leadership and mentorship since I started at MCW. Without his willingness to involve me in his work and allowing me to build relationship with his partners, I wouldn't be receiving this award today. Another special shout out to Yvonne. Ms. Yvonne Greer has been such a huge part of all of my community facing work. She has been a leader, a mentor, and a friend. I'm quoting Yvonne when I say, we've built a trusting relationship that allows all the work to get done and done right together. The MCOP coalition was around long before me, but the variety of initiatives that I've been involved in and all that we've accomplished in a short time has been of such value to me as an individual and our community. To name a few, the Days of Learning conference that over the last couple of years has turned into a podcast that highlights community engagement, health equity, chronic disease prevention, community resources and assets, and so much more. The Back to the Kitchen series led by Yvonne that puts a focus on healthy eating and wellness and brings community champions together for deep and meaningful storytelling and conversations. And the space that MCOP creates for local health leaders and community champions to come together to support a healthy community. Lastly, I know my previous leader, Dr. Saeed Ahmed, is in the audience today. I'm so happy to have caught him in between his travel. He's been living his retirement life to the absolute fullest. So I want to extend my gratitude to him for moving community engagement forward for all of us at MCW and teaching me and others on a daily basis the art and science of community engagement. These are the moments that make you stop and reflect and celebrate the wins that come with community engaged work. There are many challenges along the way, but if you keep at it, it is amazing to see what can come of partnership with one another. I'm so humbled and appreciative. Thank you.
Thank you, Kelsey, for those wonderful, wonderful words. You're truly an asset to our team and to community engagement at MCW. Our second award is for MCW staff is presented to Madeline Wynn. Madeline is a physician assistant in the emergency department at Children's Wisconsin. She is a champion for patients and families in many ways. After observing health inequities firsthand in the emergency department, Madeline was motivated to look for ways to address these disparities. She partnered with the Daniel M. Soroff Family Resource Center and started screening families for food insecurity. These screenings have led to financial and immigration assistance and enrollment in WIC and other government programs. Due to the success of the program, Madeline is now helping clinics in Children's to implement their own screening. Madeline is currently developing a kiosk corner in the emergency department waiting room where families will be able to access community resources for social and medical needs. Madeline also created a partnership with Upstart Kitchen, a Milwaukee-based nonprofit, which wanted to expand food insecurity efforts. Madeline used this partnership to start a meal program at 2 Milwaukee County Children's Wisconsin primary care offices. Every month, 150 meals are distributed to families visiting their doctors. Madeline serves on the Social Medicine Advocacy Coalition, where she inspires all with her energy and creative ideas. She is also a member of the Children's Wisconsin Justice, Equity, Diversity, and Inclusion Committee, where she advocates for diverse representation in hiring hospital staff. Congratulations, Madeline, for receiving this award.
Thank you, Dr. Young. I'm so honored to receive this award. My community engagement work began while being in the emergency department while working there. And I started paying attention to children that were labeled non-compliant or had poorly managed chronic medical conditions and recognized that a lot of these families didn't have their basic needs met. With support from my section and the health management team and the Daniel M. Soroff Family Resource Center, We started screening families for food insecurity, knowing that by asking this question, we could find out a lot about a family's social determinants of health. And in our current workflow, families who screen as food insecure receive immediate resources in the emergency department and a follow-up call connecting them to well-established community resources that are tailored to the family's needs, their zip code, and their insurance. And it's through this work that I was introduced to several more community partners who've been enthusiastic in helping combat hunger in Milwaukee and wanted to help expand our efforts. Specifically, Upstart Kitchen, as you mentioned, has provided us with healthy home-cooked meals for our patients and families in our primary care clinics. I'm so grateful for these community partnerships and the support of the Medical College and Children's, and I look forward to continuing to expand this effort and continuing to collaborate with the community. Thank you.
Thanks so much, Madeline. Again, congratulations. The fourth category of awards is for MCW faculty. This year we have 2 recipients. Our first awardee is to Dr. Piero Antuono. Piero graduated from the University of Florence Medical School and has been a member of the MCW Neurology Department since 1985. He has dedicated his career to the advancement of diagnosis and treatment of Alzheimer's disease and other dementias through comprehensive programs, basic research, clinical drug studies, and a brain bank. Piero recently dedicated himself to the development of a community clinic for Latinos with dementia at United Community Center in Milwaukee, in collaboration with UW-Milwaukee and the Alzheimer's Association. The mobile memory loss clinic addresses the unmet needs of this population with culturally specific educational programs and serves as a model of care for other minority and non-English speaking communities. In the face of the COVID pandemic, Piero was very active in helping convert the Latino Geriatric Center Memory Clinic to virtual visits to allow for continued care. Piero works to bring other junior neurologists and trainees into the clinic to assure continued and expanded access to care and testing. His activities have also included frequent interaction with media to help spread the word, not only about the Latino Memory Clinic, but to help neurologists across our city and state to understand the importance of culturally congruent dementia care and testing. Congratulations, Dr. Antuono, for receiving this award.
Thank you very much. I would like to thank, of course, you and also Dr. Raymond and the committee for the honor in recognizing our work with the Latino community as it relates to dementia, depression, and Alzheimer's disease. I also, of course, have to thank the staff, the people I work with at the United Community Center, specifically Alberto Castro, who has been one of the conspirators in getting the initiative about this award, but also Anna Bernal and Vanessa Anciani, the nurse, social worker I work with on a daily basis, as well as Shari Perez and Ana Castaneda, which really kind of form the structure and allow us to do the great work the staff does at the United Community Center. Why do this clinic in the Latino community? Because Latinos have 1.5 times more Alzheimer's disease and dementia than Caucasians, because the diagnosis, the management of dementia is very much tied into one's culture, language, life experiences, and also education. Access of medical care is done differently in the Latino community. They prefer to have that in their own community rather than going to the academic medical center, for instance. The United Community Center has been instrumental in doing the kind of work we're doing, things which I discovered as I was working with this great group of people. For instance, United Community Center has middle school and elementary school, more than 1,500 students, if I'm correct. They discovered that doing a survey in 200 students, that 37% out of the students, of the children, I would say, they are actually caregivers for the older members of their family. So this was the initial intuition of creating special programs for children in regards to education, but in person as well as virtual. And with the help of Dr. Melinda Kavanagh and Yura Lee from the Helen Bader School of Social Sciences, we were able to provide these programs and actually secure government funding for it. When, as you mentioned, COVID struck, we will be able to transfer our expertise into this new platform with significant logistic challenges in providing hotspots and iPads to families who didn't have this technology available. And again, Anna and Vanessa were very helpful in making this really possible. I find this experience personally very rewarding and challenging. I've learned that it's true. You practice different medical care depending where you are. After working almost 40 years in an academic center where you have the latest technology down the hall, all of a sudden we were dealing with people who did not speak English, had maybe issues with not being insured or were undocumented, significant lifelong stressors, whether they're social or medical. And I quickly learned to reconvert a little bit, actually significantly, what I learned in my past career at the Medical College of Wisconsin by really understanding that probably guidelines and protocols are not as important as using clinical judgment, knowing the person sits in front of you as much as the disease that the person may have, so that we could still improve their quality of life, because that's the main reason why we do the work we do. Thank you.
Thank you so much, Piero. Congratulations. Our second faculty award is presented to Dr. Kirsten Beyer. Kirsten is the Associate Professor of Epidemiology and Social Sciences in the Institute for Health and Equity. She is the Director of the PhD program in Public and Community Health, the co-director of the Global Health Pathway for medical students, and co-director of the Geospatial Epidemiology and Outcomes Shared Resource of the MCW Cancer Center. Her work focuses on the intersection of health, place, and social justice from a global health perspective. She seeks to understand the root causes of health inequity and leverage community engagement to generate policy and practice changes with a focus on cancer, cardiovascular disease, and mental health. In partnership with Milwaukee nonprofits, schools, and government agencies, she studies the impacts of redlining, green space, and climate change mitigation on health equity. She currently serves as the principal investigator on a National Cancer Institute grant to investigate the link between institutionalized racism and residential racial segregation to breast cancer disparities between Black, Hispanic, and white women in the United States. She leads an American Heart Association strategically focused research network on cardio-oncology disparities. Kirsten has strong partnerships with the 16th Street Community Health Center and the Urban Ecology Center, where she works to improve adolescent mental health through nature-based activities. In 2019, she was named the Women Leader in Global Health Midwest. In September, she won the Milwaukee Business Journal's Healthcare Champions Researcher of the Year Award. Kirsten and the Milwaukee County COVID-19 Epidemiology Intel team work to map and provide data analysis of COVID-19 incidents, hospitalizations, and deaths in Milwaukee and surrounding regions. This data was used by health departments, school districts, community partners, and MCW leadership to inform decision-making and resource allocation during the pandemic. Congratulations, Dr. Beyer, for receiving this award.
Thank you, Dr. Young. Wow, this is such an impressive group of people. It's hard to go last, I have to say. It's such an honor to receive this award on behalf of my team and my many collaborators. Some of these pictures that I dug up from the past are pretty old. This is one of the best ones here at Urban Ecology Center from back in the day. I want to offer my thanks first to Tiffany Fraser and Steve Hargarten from the Office of Global Health, meant to partnering with communities around the world to achieve health equity. Thanks also to the Office of Community Engagement for this recognition, and also mostly for the opportunity to share this virtual stage with such an amazing group of people. Such impressive work. I'm forever grateful to my family for sharing my time, my commitment, and my love with my partners, even if I must sometimes sweeten the pot and come home with things like soccer jerseys and coffee beans. I'm honored also to be at an institution that values community engagement so clearly and so highly, and invests in a real way in bringing that community engagement mission to life. So thanks especially to Dr. Raymond, Dr. Young, and the many other MCW leaders that make that possible. Thanks to my department, the Institute for Health and Equity, for supporting community engaged faculty. There are many of us. And especially to the IHE staff who do the hard work of keeping things like grant submissions, finances, and IRBs humming. Thanks to the learners in the PhD program in Public and Community Health and the Global Health Pathway for reinforcing my passion for health equity and keeping me excited about our future community engaged leaders. There are many good things down the road to come. So I guess the main thing that I wanted to say is that everything in community engagement is done as a team. As I sit in the comfort of my office, which I haven't seen very much over the last few years, to receive this award. Several of my team are actually in the community right now, hard at work in MPS schools at the moment. So thanks especially right now to the anchor of my community engaged research team, coordinator Courtney Jankowski, as well as our incredible group of dedicated staff, trainees, and collaborating faculty, many of whom are shown in the photos. And 1,000 thanks to all of the community partners, past, present, and future, at home and abroad, for all of the contributions they've made over the years, and for the opportunity just to work with so many great people. As we see every day, including yesterday, the world is full of quite daunting challenges, where the work of pursuing public health and health equity is really never going to be done. And so I think events like this are really important. We energize each other through community engagement to keep up that fight. So thanks to all of you for helping to energize me again today.
Thank you so much, Kristen, for those phenomenal remarks and for encouraging us in the work that we do. Everyone here has been so inspiring. I love listening to all the comments, reading the comments in the chat, and seeing the photographs. It's really inspiring, everything that all of you are doing. And as we close out our program today, I'd like to ask all of our awardees if you could please turn on your cameras so that we can give everyone a virtual round of applause for all of our awardees and to thank them for helping to advance MCW's community engagement mission. Thanks so much for the round of applause from our audience. That concludes our ceremony for today. Thank you so much for all of our awardees, to our leadership, President John Raymond, Dean Joseph Kirshner, and for all of those that are in attendance at the audience today. We thank you for joining us, and we wish you all a safe, healthy, and happy rest of your week.